Continuing from the PowerPoint, child and adult depression is rising. Today, almost 20% of the population meet the criteria for some form of depression. That does not mean people who are temporarily feeling the blues and will be better next week, but people who are having a real difficulty functioning in life. 1 in 5 people suffer from depression. If you count every 5th person in this room, that's how many people may be suffering from depression at this time. Children of depressed parents are 2 to 3 times more likely to exhibit elevated levels of depression and anxiety symptoms than children with non-depressed parents. Babies can be affected as well. Studies have found that depressed mothers and fathers have difficulty bonding with their infants. They are less sensitive to the baby's needs and less consistent in their responses to the baby's behavior. The babies appear more unhappy and isolated than other children. When the depressed parent isn't able to get help, the outlook isn't good for the child. The child grows up with dangerous and destructive ideas about themselves, feelings of being unlovable, being uncontrollable, and an inconvenience, risking depression. Children of depressed parents are at a higher risk for depression themselves, but also at a risk for substance abuse, antisocial activities, physical harm, self-harm, and they become troublesome. Often the child is reacting to the parent's depression. A troubled child is sometimes just trying to get them to be parents, to put their foot down, enforce rules, and pay attention. And when the depression is treated successfully, the parent has the energy to pay attention, to set limits, to be firm and consistent, therefore lowering the risk of depression for their child, and the child's behavior improves. When teens feel sad, distressed, anxious, confused, or depressed, the emotions might be so extreme that they lead to acts of self-injury, also called cutting, self-mutilation, or self-harm. Most teens who inflict injury on themselves do so because they are experiencing stress and anxiety. Besides cutting and scratching, hitting, biting, picking at skin, and pulling on hair are some of the other ways teens use self-injury to cope with intensely bad feelings. They may do this at moments where they need an immediate release for built-up tension. Self-injury is an unhealthy and dangerous act and can leave scars both physically and emotionally. How is depression diagnosed in children? If the symptoms of depression in your child have lasted for at least 2 weeks, you should schedule a visit with his or her doctor to make sure that there are no physical reasons for the symptoms, to make sure that your child receives proper treatment. A consultation with a mental health care professional who specializes in children is also recommended. A mental health evaluation should include interviews with the parent or primary caregiver, the child, and any additional psychological testing that is necessary. Information from teachers, friends, classmates can be useful for showing that these symptoms are consistent during your child's various activities and are a marked change from previous behavior. There are no specific tests, medical or psychological, that can clearly show depression, but tools such as questionnaires for both the child and parents, combined with personal information, can be very useful in helping diagnose depression in children. Sometimes those therapy sessions and questionnaires can uncover other concerns that contribute to the depression, such as ADHD, conduct disorder, and OCD. About 2.5% of children in the U.S. suffer from depression. Depression is significantly more common in boys under age 10, but at the age of 16, girls have a greater incidence of depression. As in adults, depression in children can be caused by any combination of factors that relate to physical health, life events, family history, environment, genetic and biochemical disturbance. Depression is not a passing mood, nor is it a condition that will go away without proper treatment. Children with a family history of depression are at a greater risk of experiencing depression themselves. Children who have parents that suffer from depression tend to develop their first episode of depression earlier than children whose parents do not. Children from chaotic or conflicted families or children and teens who abuse substances like alcohol and drugs are also at a greater risk of depression. According to the American Psychiatric Association, children whose parents are depressed have been found to be at risk for the development of depression, anxiety, conduct problems, and poor overall functioning. Because depression is the most prevalent psychiatric disorder in the adult population, and therefore the most common psychiatric disorder to which children are exposed, it is essential to understand both the prevalence and symptoms of depression and how they might impact children of depressed parents. Within the general public, depression has been estimated to affect 6% of the female population at any one point in time, and will affect 10 to 25% of women at some point in their lives. Parental depression places children at risk for maltreatment and poor parenting. Depressed mothers are more likely to physically abuse their children and to be more deficient parents than non-depressed parents. Additionally, depressed parents have been shown to be more hostile toward their children and to interact less with their children than non-depressed parents. How to get help. Antidepressant medication and focused psychotherapy can efficiently help 80 to 90% of depressed patients, and the earlier it is caught, the better the chances of success. Treatment options for children with depression are similar to those for adults, including psychotherapy, counseling, and medication. Your child's doctor may suggest psychotherapy first and then consider antidepressant medicine as an additional option if there is no significant improvement. The best studies, however, to date indicate that a combination of psychotherapy and medication is most effective at treating depression. Thank you.